We begin with a familiar announcement.
I hereby further direct the National Government Administration officers, jointly with the National Police Service and county government enforcement officers, to strictly enforce this public order, regardless of the social status, political status of conveners of such political gatherings or social gatherings.
Well, there are no new containment measures for now, but have you ever wondered who exactly advises the president on this issue and how they arrive at their recommendations? We sent our health reporter, Eunice Omolo, out to find out.
If there are any questions, maybe we can call that shortly.
The team at the Center for Epidemiological Modeling and Analysis, established in 2020, is hosted at the University of Nairobi to enhance decision-making driven by data in order to improve health in Kenya and in Africa.
As you realize, the pandemic was new and government needed to make decisions rapidly. You could actually make those decisions based on your mental models, or you could simplify the biology of the virus and the behavior of people into mathematical equations that can help predict better what's going to happen in the coming days. So SEMA has been at the forefront of providing that kind of expertise to the government of Kenya to inform the responses that you have had as a country.
During the pandemic, this center has played a critical role in the rapid analysis of COVID-19 data, clinical management of patients, and the epidemiological projections that have guided responses to the pandemic within the country. Here, numbers collected from various testing centers are entered, tabulated, and analyzed by a team that consists of data analysts, epidemiologists, and researchers to understand the nature and spread of the virus.
How to educate communities around what makes sense, what doesn't make sense, and when to present. We've gotten a lot of experience in managing patients as well, and that is important to harness because COVID-19 may not be our last pandemic. So as we go forward, how do we keep this lesson so that if something else comes up, we can, awaken whatever we've learned and use it to manage a future pandemic.
If we just look at it, so we can see the number of hospital admissions per day is starting to increase gradually.
At a time of public health crisis, where real-time decision-making is paramount, this technical review team has enabled different modeling groups within the country to exchange and enrich ideas, bringing transparency and objectivity to modeling and analysis approaches. However, Kenyans have been skeptical about the numbers given in the daily updates of coronavirus situation in the country.
Kenyans are saying, oh, this data is being made up by government. The government is allowing you to be able to access this data. So what SEMA is doing, one of the biggest roles is democratizing access of data and health data and allowing anyone who has some skills to be able to go and access this data, read for themselves, analyze for themselves and see it. That helps you see things for yourself with your own eye and with your own lens.
Experts working here say the data approach used for COVID-19 could also help the country on other troublesome diseases.
The West had data. We've developed guidelines based on what the West had. And it's time that we developed guidelines that were specific to our situation. And the only way we can do that is if we have our own data.
Eunice Omolo, NTV, Nairobi.
How interesting. So when we get the new brief from the president, we know where most of that information came from.